Why are dental cleanings essential? A beautiful smile is a symbol of a healthy and well-cared-for gums, which is why dentists recommend having visits twice a year. However, for many people, this can be a time of stress. Welcome to another informative video from Channel Islands Family Dental. Today we will talk about dental cleaning. Prophylaxis or dental cleaning as a procedure consists of the thorough cleaning of the external surfaces of the tooth. It is always performed in the dental office. Prophylaxis is an important treatment to help stop the progression of periodontal disease and gingivitis. Healthy gums are usually pale pink in color and soft to the touch. They usually do not bleed when brushing or flossing. Also, healthy gums are usually not inflamed or swollen, and they remain firm and attached to the teeth. When the gums and teeth are not cleaned properly, it not only creates an aesthetic and appearance problem, but it can also cause oral health problems. Tartar on the teeth and gums, caused by the accumulation of food debris, turns into plaque and can also cause cavities, either due to a lack of oral hygiene or, in some cases, due to a disease. Gums with gingivitis will appear dark reddish and shiny. They will have a tendency to bleed spontaneously or upon any stimulus. This is the initial phase of periodontal disease. Begins the demineralization process, eventually becoming dental calculus. This destruction of the supporting tissues generates periodontitis, which being irreversible ends in the loss of the affected teeth. Daily oral cleaning helps to remove food residue, preventing bacteria from demineralizing the tooth, thereby generating cavities. Sometimes, this is called dental prophylaxis. Additionally, it prevents stains and removes the tartar that accumulates in the gums. To avoid both gingivitis and periodontitis, it is recommended to practice the habit of brushing your teeth after meals, flossing, and rinsing at least once a day. Dental prophylaxis or cleaning is a procedure that helps maintain good oral health and stops the progress of periodontal diseases. The entire surface of the tooth is thoroughly cleaned, both above and below the gums. Depending upon the state of the teeth and gums, other treatments or deep cleanings may be required. Cleanings help prevent gum disease, while regular visits to the dentist will allow for the identification of oral health problems in time. Thank you very much for what you have explained. If you have any questions about this or other topics, you can contact us at Channel Island Family Dental, as well as our Facebook page. We look forward to your visit, and we will make a timely diagnosis. Our dentists in Oxnard, St. Paula, Venture, Newbury Park, and Port Hueneme will be able